Robin Williams suffered with addiction and depression much of his life.
Well, it is a disease that many don't want to talk about, and some people are even ashamed to discuss it. Others think it's just sadness that they'll get over in time.
Well, make no mistake, depression is serious and needs treatment like any other disease. Here to talk about it is Dr. Leon Rosenberg of the Center for Emotional Fitness. Doc, good to see you. Thank you for being here. I tell you, you'd never imagine someone so happy could be so sad. How can you know if someone you love, someone you care about is having a problem, especially if they appear so differently on the outside?
Well, differently is an important way to talk about it. So if somebody's having mood swings, the moods are unpredictable. When they go to bed at night, they don't know what mood they'll wake up in the next day. Suddenly they have a prolonged period of sadness they haven't had before. There are many signs that people are not doing well. And unfortunately, even somebody like Robin Williams, there was an interview with Terry Gross he had. She said, "What's the diagnosis?" And he said, "I've never been diagnosed with either depression or bipolar disorder." So the fact that he never had a diagnosis is important. You talk about being ashamed. It may have been that he just didn't want to nail it down. And it's important to nail down what the problem is so you can get the treatment that you need to get help.
You know, they talk about somebody like a Robin Williams who used his comedy to kind of cope with the depression or to cope with his addiction. Do you find that also with ordinary people, somebody who's not on stage?
It may be. I mean, but we want to find that it's good to have coping mechanisms. But when the coping mechanisms don't work, or they take 24/7, and you may need more help because if your whole life is devoted to just treating the illness, then where's the value of life?
Okay, so you know, we have you know, on a graphic that we're going to show everyone a few of the symptoms, and it might be recognizable for individuals. And we talk about loss of interest, change of weight, energy loss. Tell us a little bit more about
so
that.
In terms of the very important thing is loss of drive and motivation. That's not one of the symptoms you have up there. Persistent sadness is very important. Somebody feels sad most days, most of the day. But people use their own words: blue, empty, tearful, crying. There are different signs. And I have on my website, 866.Leon, I have a book I wrote on psychiatry. They can go and download all the symptoms and look at it, make self-diagnosis. In fact, bipolar disorder, they just changed the diagnosis. And it's important to talk about bipolar because he may have been bipolar where he felt too good, too happy, then resorted to using drugs and alcohol because he said, "Oh, I can just do just one." He talked in an interview that he heard a voice saying, "You take just one or kill yourself." He was plagued by this problem. So people want to understand the illness just the way they understand everything about themselves. It should be something that people, you know, like what's your sign, you know, what's your disorder. People have, 50% of people in a lifetime have a problem. And it's sad that we don't let them talk about it.
How should you approach your loved one, Doc, before we go?
So they can say, "Hey, they saw this interview today." They can go to my website. They, you know, because of Robin Williams, maybe didn't have a diagnosis. I've looked up this. You know, maybe you do have a problem. Let's get the diagnosis. Let's nail this down. Let me help you. I love you. You know how much I love you. First, lead with that positive. I love you. I care about you. I've been thinking about you. So I looked up on 866.Leon, saw the interview, saw the diagnosis.
And simply, it's not scary to get a diagnosis.
No,
it's your way to get help.
Well, it is a little scary at first. That's why people avoid it. But then once you get the diagnosis, then there's treatment. If you don't get treatment and to avoid this problem, maybe he wouldn't have killed himself if he had appropriate treatment. We don't know what he did and didn't do.
No, Doc,
One step at a time.
Thank you. Thanks
Doc.
very much. Well, the death of Robin Williams has brought depression and suicide to the forefront of the headlines. If you know someone who needs help, it's only a phone call away. The phone number for the National Suicide Hotline is on your screen. It is 800-273-8255. We're coming right back.